Okay, we'll go into our 8:35 item, COVID-19 Public Health Director Kathy McKay. And Jamie's with, and we're going to hear all sorts of good things about vaccines and everything today. Okay. Good morning.
Good morning, Mr. Chair and Commissioners. I passed the initial handout around, and you'll notice it's a little bit different. We have another individual providing some of the information. So you see, hopefully it's a graph, so hopefully it's easy to understand. We see the number of cumulative cases of Clay County in the first column, and then Minnesota, and then we see North Dakota and Cass County. So the cumulative cases of 6,432 in Clay County, and then in Minnesota, it's 447,392. Our active cases are around 130. And in Minnesota, 12,346. And then those out of isolation, so the cumulative cases, and then the 6,222 out of isolation out of those cumulative cases. In Clay County, we have an additional 2 deaths from the last time we reported, so we have now, unfortunately, 80 deaths. So, so our active cases are pretty close to what we're seeing. And in Minnesota, excuse me, 429,325 out of isolation, and their cumulative deaths in Minnesota, 5,721.
Kathy, I got a question on the cumulative active cases, 130. What is that figure? People that are in the hospital or?
Those are the active cases that we would be following that are still actively having the virus. So we're following those cases, those that are in isolation. So you see the total number of cases we had cumulatively. Those that were out of isolation are those that they typically will report as recovered. And so these 130 is what is currently the cases that we're following that are active cases.
There could be a lot more that have tested positive.
There could. This number changes pretty regularly, almost daily.
Okay.
So. Did that answer your question, Commissioner Gross?
Thank you, Kathy.
Okay.
Thorough.
And then we have the cumulative hospitalizations of Minnesota residents, so 267, that's a cumulative number. And then in Clay County, 267. In Minnesota, it's 23,185. And then the numbers that were cumulative for ICU admissions, so 73 out of Clay County and 4,850 throughout Minnesota.
That's during the entire time. That's
Correct.
What you mean by that?
That is correct. And then we have a column of people with getting at least 1 dose of the vaccine. So we've added that column. Currently in Clay County, 1,291 individuals have received at least 1 dose. 185 have completed the series. So those are individuals that have received their first and second dose. In Minnesota, 194,462 have received at least 1 dose of the vaccine, and 38,025 have completed the series. So those would be the ones that, of course, that received the 2 doses. Now in Minnesota, we've had 407,575 vaccines shipped from the federal government to Minnesota, 109,100 to long-term care facilities. So far, 516,675 have been shipped to Minnesota for disbursement. They initially promised 626,925, so we haven't received the full amount that they promised, but we have 516. And those are broken down. 19% of that was Moderna. That's the vaccine that public health is providing. That's the frozen vaccine. 309,000 of that, 309,075 is the Pfizer. And Pfizer is that ultra cold, so that went to healthcare facilities, most of that. So 60% of that vaccination that was shipped was Pfizer, 19% was Moderna, and then, excuse me, 21% went to the long-term care. through the, much of that, like in our county, that was the federal pharmaceutical, they signed on as a provider, so they provide the vaccine to our long-term care and assisted living.
Okay, so Kathy, so you mentioned the number 516,675 delivered to Minnesota. And again, I'm looking at the people who have received one dose is at 194. Are we still that far behind
Well, this,
in Minnesota for?
yeah, and this number will change. We'll see more of that today, the changes in numbers, but at this reporting time, that was all that was, all the individuals that received one dose. We do know that the pharmacy federal program that's providing to long-term care and assisted living, we do know that they still have doses to get out. For the first phase 1 group, they have not gotten all of their doses out. We don't know the exact numbers of those, but even as we've had some of our staff call our long-term care, we have a couple of facilities that are scheduled. It's just going to be a couple weeks before they get those doses. So it's, there's some delay in that, but there's also the delay in getting that vaccine to us as well. So we should hopefully see these numbers rise. I can tell you in Clay County, all of the doses we received have been distributed.
Good.
So we do a weekly distribution. We don't hold on to the vaccine. I want to make that very clear. We get the vaccine out. We get it shipped 1 week and we get it out by the next. So we don't hold on to doses. So all of ours is out. We're hoping to get a bit more this week, so.
Okay,
Go
sorry.
ahead, Frank.
If you ship out all your doses every week, the people that need their second dose, is there available vaccine for them then?
The Minnesota Department of Health is stating they're going to give us the second doses, particularly for Moderna, which is the vaccine we're using right now. So they will be giving us second doses. In fact, we have something on the docket that we have 100 doses that we will be using for second doses. That's our first shipment of the second doses. So we can't use that for the first doses. They've had it allocated that we'll use that for second doses.
Well, it looks like you'll need 1,291.
Correct. And they will continue to ship that. They've assured us that they will be shipping our second doses. They know how many we've provided for first doses because it's all recorded within 24 hours, and on our, the Minnesota has a reporting system and it goes into a immunization registry. So all of that is recorded. They have the accurate information about what we've provided, and then they have assured us that they'll ship our second doses.
Thank you.
Kathy, I've received notice from my healthcare provider to get on a list. And there's a form, you go to the Sanford site and get lined up. Now, my understanding is that Sanford is not distributing vaccine on the Minnesota side, that their hospitals that are doing the vaccine, and now the center they're going to open up are in North Dakota. Are Minnesotans who are going to Sanford or to a North Dakota-based hospital, is that allotment coming out of North Dakota, or is Minnesota obligated to supply them, or do you have any idea how they work that?
You know, Commissioner Ebinger, the allotment that like Sanford and Essentia received, those doses that they've provided, I'm sure they have quite a number of individuals that live in Minnesota but work in their facilities. Those individuals would be vaccinated. It would be recorded under the North Dakota allotment. There wouldn't be any Minnesota vaccine that's shipped over to them. And Jamie, do you know about the individuals that need to sign up? You probably know about that one. Just the general population.
So Sanford and Essentia sent emails to people or a My Chart message basically saying if they have a North Dakota provider, they will contact them. The Minnesota Department, or North Dakota, the coalition meeting, the FM coalition meeting last week that I was not listening to, but was understood that they did plan to vaccinate Minnesota people if they have a provider on the North Dakota side. On the Minnesota side, we haven't had that discussion yet for vaccinating at the clinic level.
Okay, thank you. It's one of those things is a moving target then.
That's correct.
Absolutely.
Yeah.
Right, well, thank you.
So then I can finish up the data. On the second page, it's hospitalizations and ICU hospitalization. So that's generally across Minnesota. And of course, if Clay County residents were in a Minnesota hospital or in intensive care, we have the numbers there. So you can see the graph shows the number of folks, 23,113 that had hospitalizations based on COVID, and 4,836 that were in intensive care in some place in the hospitals in Minnesota. So those, if there was any Clay County residents that were in Minnesota hospitals, those are included in here. We don't have a breakdown of those. And then the third page, you can see the Clay County cases reported per week. So it gives you weekly, kind of the graphs showing the cases, and, as we see the real surge or the uptick, as we call it, in November, you see the number of cases that have risen. So the graph kind of depicts what our cases look like week to week. Hopefully that is a better explanation than the other numbers that change pretty regularly. So at least it kind of depicts the numbers of cases up through the 10th. And then the other graph at the back is the deaths reported per week. So we had a large number of deaths at the beginning of our pandemic. And then we saw, of course, another increase in end of October, in November and December. So we're seeing numbers of deaths reported there. Period of time where there wasn't deaths. So hopefully those graphs, you can get a better picture of what that looks like.
I guess my only one thing that I'm missing here is the active cases by age groups that I had asked for, and it's no longer in your report.
We can certainly add that. Thank you. Yes, we will add the active cases.
I mean, I think it shows some good information, and it can give insight onto where we might have to target messages. So,
Sure, absolutely.
yes, Commissioner.
Kathy, I think that maybe we should respond just in this meeting to the article that was printed in the forum in regards to Clay County being the lowest in the state in terms of vaccinating folks. I want the public to know that your team is really doing an amazing job, and we have been in meetings since July in terms of planning for vaccine rollout, and I think that we are ready to vaccinate as many people as we can. The holdup seems to be the amount of vaccine that you're getting, and as you said, we don't currently have anything. We've given all the vaccines that we've received. And so I think the other piece that was missing from the statistic was that there are a large amount of people in Clay County that have been vaccinated in North Dakota counties, and those numbers aren't being reflected. I think there is probably much more people that are receiving these first and or second doses than is being reported for whatever reason, but I think as a person on this board, I think it's important that this board takes a stand to advocate for more vaccinations allocated from either the federal government or the state. It is imperative that as one of the top 3 fastest growing metros in the state of Minnesota, we receive vaccinations that are reflective upon that population growth. And it's disappointing to me that there has been other priorities given in the state. I know that it's vital for as many people as possible to get it, but it needs to be equitable statewide, and it's not appearing so for whatever reason. So I'm hopeful that we can get more, but I have a lot of faith in your department to administer those as you get them.
Thank you, Commissioner Mojo. I wanted to mention too that our Minnesota Healthcare Coalition coordinator offered us some Pfizer vaccine. That's unusual because the Pfizer vaccine through the Minnesota Healthcare Coalition goes to the hospitals. But the fact that we don't have a hospital in Clay County, she'd offered to provide us vaccine. So I accepted that. We did have Josh from our department had early on reached out to see who has ultra cold storage when we were going back and forth about needing that. So an individual from one of the clinics here offered to store that for us in their ultra cold storage, which is very helpful because if not, that amount of vaccine would have to get out within 5 days. We don't have ultra cold storage in public health. And so we had just communications late last week with Healthcare Coalition coordinator and the clinic staff who volunteered to store that for us. And then they're willing to partner with us. So they can also, they have staff, they can provide vaccine out of that Pfizer amount. We're allowed, it's allocated to public health, but we're allowed to have any partners we deem available and can assist in getting that vaccine out as quickly as possible. So we're pretty excited about that partnership. We're going to reach out to the other clinic as well. So that's good news that we're getting quite a number of doses through Pfizer. And we anticipate late this week that they should receive that at the ultra cold storage. And then we'll work out a distribution plan with the staff. So we will have more doses than just the Moderna. So that's good news.
Kathy, I think Commissioner Ebinger wanted to follow up on comments from Commissioner Mojo. So.
Yeah, I was concerned after the article came out. And as is often the case, the headline is made to draw your eyes to the article, and it elaborates in the details that maybe it's not quite reflective of what the headline says. I am very happy with the response I got from public health and from you, Kathy. The efforts that are being made to immunize our people, we are ready to go full steam. The holdup is getting vaccine. The governor is frustrated. He's expressed his frustration. I think locally we are frustrated. Personal experience, I know people who have been immunized, in discussing this, have been immunized in North Dakota. My wife is a volunteer with hospice, and she was immunized in North Dakota. They have vaccine, and it's being used and delivered effectively. We are ready to deliver vaccine effectively. I'm comfortable with all the preparations been made. We just need to get the vaccine. And that is a problem. This is where you say my old job is above our pay grade. But anything the commission can do to help, we're here.
I just want to follow up on that as well. And I think the issue appears to be, you know, the vaccines that we're getting into people's arms right away, which is what needs to be done. At the state level, I can't say the same thing is happening based on the numbers you presented us today, because I think it almost falls below 50%. And that's, to me, that's troubling. But I want to also, there must be a way that we can somehow monitor what Clay County is getting in terms of its share of Minnesota total vaccines. I think for a county, as Commissioner Mojo said, that's growing like we are, and we're giving proof that we're administrating that vaccine when we get it, that we should rank high in getting that, and any message that, as Commissioner Ebinger just said, that we can give as a commission to the Department of Health or to the governor to let them know how we're doing on this, we should be doing that. So, okay. Continue on.
Okay, anything
Okay.
you have, Jamie?
I won't repeat a lot of what we already discussed related to vaccine, but I will point out that I did see on the Minnesota Department of Health website that And the governor repeated yesterday several times that there are 60,000 doses per week coming into Minnesota. And there's 5.6 million citizens in Minnesota, so that's just 1% of the supply needed. And so I think that was like, yes, that's what we're dealing with. In Clay County, as we've talked about, you know, we're on a weekly basis, we're communicating with the State Health Department that we are prepared and ready to administer vaccine, and we are asking for additional doses. And so that's what we're doing. We're actually trying to get it out the same week even, you know, depending on what time during the week to get that done. We are preparing our healthcare providers. In public health, our responsibility is healthcare providers. We're preparing them so that they're responding very quickly when we do send them an invite for one of our vaccine clinics. So they too are doing everything they can in order to make sure they're getting that vaccine and they're not on our next invite list the next time. And so basically, we have 2 clinics scheduled for this week. We talked a little bit about the doses. So far, we've administered 700 doses. We're expecting 400 of that first dose this week again. And then also, we are going to be getting some of our second doses. So they continue to tell us in Minnesota that we will give you second dose and that we need to hang on to those when we get them. But first dose will be administered immediately. Another thing that happened, we had a meeting yesterday with Minnesota Department of Health to discuss the governor's press conference yesterday and shared some of the information with us on that. We had requested to be a pilot site. The governor did announce that there are pilot sites. There are 9 pilot sites in Minnesota to administer vaccine. And right now, there's a target population for that, but they are hoping that those will be mass dispensing sites in the future. We did request that. What we understood is that they were looking for storage capacity, and so we were not chosen in that case. But with the governor's announcement of the pilot sites that will open up for vaccine distribution starting this week on Wednesday, Thursday, Friday, and Saturday. The Minnesota Department of Health will be the agency responsible for scheduling appointments, and also they'll do that online, and they'll have a phone center as well. So the pilot sites that were chosen, and those are, the closest one to us is Otter Tail County in Fergus Falls. There's one in Pennington County, Thief River. There's one in Stearns County, which is St. Cloud. And then Nicollet County, St. Louis County, Olmsted County, Lyon County, Hennepin, and Anoka. Those are the 9 sites that were chosen. With those sites, they will be serving the population identified by the governor, which is Minnesotans age 65 and over, the pre-K through grade 12 educators and school staff, and child care workers. And the way the system will be set up is that because there are very little doses, and I believe it was 12,000 for all 9 of those sites that they had available, then the Minnesota Department of Education has been working with Minnesota Department of Health on the number of doses they will receive for each of their school districts or school districts that are chosen. I'm not even sure if they're all getting them. And so they will decide who would receive those doses within the school system. So that registration does not go through the Minnesota Department of Health initially, but once they receive that I will be getting the vaccine, then they would register also with the Minnesota Department of Health. Child care workers would be actually chosen randomly to receive the vaccine at those sites. So that's how they'll use those 12,000 doses across those 9 sites, and their hope is that they would have that as an opportunity for people to access. So what does that mean to us in Clay County? It means that if you are in that age group and you are contacted by or if you're pre-K through 12 or a child care provider and you're notified by your employer, then you can schedule a vaccine at the Fergus Falls site. You can choose the site. You can't sign up for more than one. For the 65 and over, you would have an opportunity to call in or register online for a vaccine if you choose not to wait till your provider contacts you in our community. In Clay County Public Health, we continue to do what we have been doing, which is our priority as healthcare providers in Phase 1A. We continue to work on that, and the pharmacy program continues to vaccinate our long-term care residents. All of our nursing home residents and staff that have requested vaccine have received it, and they are moving through our assisted livings right now. So that's pretty much, and the rest, and because of the shortage of vaccine, we need to continue to follow what we have, wear a mask, keep our distance, and stay home if we're sick. See some frustrated faces right now.
Sometimes it's best not to speak. I do want to bring up something that I had asked both of you about quite some time ago, about research on those who have had COVID. And, you know, it was out there that it might be 90 days to 120 days. Just this morning, I was watching Good Morning America. And apparently now they've come up with some studies that is showing that it could be significantly longer. They did some tests from 12 weeks to 6 months. And they were showing that still after 6 months, there was enough, whatever that is that's in you that creates antibodies. So that might be some good news coming forward in terms of those who have had COVID already. So I don't know if you've heard any more on that, or.
You know, when I was at Vitalent, I asked about the convalescent plasma, and they have individuals that were positive in May to provide convalescent plasma. They still have antibodies.
From how long ago?
I was just there 2 weeks ago. So they told me, so individuals that were positive in May are still donating the convalescent plasma. So that's a pretty good, that's beyond the 90 days. So that's the information they have. They initially were only getting one convalescent plasma donation per day, and now they're getting about 6 per day. So it'd be nice if it was more, but it has increased, so.
I saw a deal on the national news last night too, that there was a request for convalescent plasma from, through, you just said it.
Vitalent, or,
No.
That one was Red Cross, I think.
Red Cross.
oh, Red Cross.
Red Cross, and they had a woman on there who had received it, and they basically said it saved her life, so.
Yeah.
Donate plasma,
Yep, donate plasma. It's great, and the more people
if you can.
donate, if you can, and even if it's beyond 90 days, it's worth getting checked, because you may still have antibodies that they can still use your plasma for, so.
One other thing, I know in your report, you talked about the fact that we were passed over because of availability or storage and freezers that we had. We tried in July and since then to get those freezers, and for whatever reason, they were unavailable. Kathy, you worked really hard to make sure that we could get those so that when we did get a vaccine, it would be available, and they were nowhere to be found. So I am thankful that there are partners in the community that are willing to store things for us. I think that's a really important piece, but I think so often we hear about being thankful for our frontline workers and our nurses and those in the hospital and long-term care settings. And I am eternally grateful for the work that they do in our community. I know this whole board is that, but the piece that sometimes goes unsaid is the toll that it takes on your own department. And Kathy, if we would have told you a year ago that you had to come to us every week for almost a whole year, I think you probably would have had a heart attack, and that might be an understatement. So I appreciate the fact that not only do you come here every week, but you get the information out as soon as you know it, and it's a changing story all the time. And unfortunately, our frustrations sometimes gets passed on to you, so I'm sorry about that. But I want you to know sincerely that the work that you do in our community will forever be thankful for that. And it's been a long year, almost. It seems like a year, 8 months, whatever. But I know that there's a lot of stress that you experience, and I'm sorry for that, but I'm thankful for the work that you're doing.
Here in Clay County, we couldn't be prouder of our public health department.
Absolutely.
And
Thank you. And I will also say that we're all very proud of her as our leader as well. She keeps us laughing while we are going crazy working, so that says a lot too. And we actually had our first incident management team meeting the last week of January, talking about February and some of the celebrations that were going on, and yeah, it's been a long time.
well, hold your heads up high. You've done a lot of good things.
Sorry, it's lack of sleep. I think.
Okay, we've all experienced that. Okay, well, anything else today? Thank you both for your report.
Thank you.
Thank you.